Every year, thousands of Malaysians from all walks of life are afflicted by cancer. Their lives are changed tremendously as they need to endure both the physical suffering and emotional uncertainty brought about by the disease. Often, cancer patients from poor financial backgrounds die not because the disease is incurable, but because they cannot afford the treatment. In the 22 years since establishment, MAKNA has been able to deliver assistance to over 450,000 cases of cancer patients needing aid and has disbursed millions to support them to ease their burden. We assist nearly 5,000 new cases every year through referrals from 88 government hospitals. Our Bursary program provides aid to underprivileged cancer patients through financial assistance, purchase of non-formulary drugs, surgical equipment, prostheses, appliances, and nutritional food supplements, most of the items that cancer patients require for during their treatment period. In 2015, we disbursed over 6 million ringgit Malaysia in aid to these patients. Getting the patients what they require during treatment is only one part of the equation. The other is ensuring that the aid provided reaches them and that they have the necessary support to continue with their treatments. MAKNA Home Visit Team does just that. Each patient enlisted under the MAKNA Bursary program is visited at home. During these visits, the Home Visit Team ensures that donations are channeled to the rightful recipients. They are also able to establish rapport with patients to better understand their socio-economic background and their needs. This team also plays a vital role in providing emotional support and encouragement to patients to continue with their treatments and checkups. This is where MAKNA volunteers play an equally crucial part. Most of these volunteers are survivors who have been through the harrowing experience of cancer or people who have been touched, whether directly or indirectly, by the plight of cancer patients. These volunteers are invaluable in helping MAKNA extend its support to a larger group of cancer patients as they undergo treatment to combat the disease, whether it's conducting awareness meetings, talks, fundraising campaigns, or even supporting the home visit team in making calls to patients in their homes. One of the essential components in the patient's fight against cancer is emotional support and encouragement. This is why, on top of financial aid, MAKNA maintains a helpline and organizes a support group headed by personnel trained in oncology and counselling with the aim of not only supporting the patients but also their families and caregivers. Aside from helping cancer patients, another key objective of MAKNA is to help reduce cancer incidences in Malaysia. MAKNA channels resources into continuous education to drive awareness and encourage positive health behaviour changes in the general public. Encouraging positive changes, prevention and early detection, these are the fundamentals that will help reduce cancer morbidity and mortality. With that in mind, MAKNA launched its digital mobile mammogram unit in 2011 to deliver breast cancer screening service to rural locations to serve communities who are unable to afford or have access to screening centres in Malaysia to better their chances because cancer, if detected early, can be treated. This also explains why MAKNA has determinedly embarked on cancer research actively for the past 14 years. Through collaborations with universities and research institutes, through fundings and grants, MAKNA aims to help advance the knowledge in prevention, detection and treatment of cancer with the ultimate hope of driving down cancer mortality. Even the poorest should have access to life-saving medicines. Based on this, the MAKNA Cancer Centre was established in 1999 in collaboration with Hospital University Kebangsaan Malaysia. This centre provides comprehensive, state-of-the-art facilities to underprivileged cancer patients with the availability of an oncology ward, radiotherapy services, and a bone marrow transplant ward to enable them to undergo important life-saving treatments which they could not have afforded otherwise. Anybody who qualifies shall be helped. Not may be helped, but shall be helped. That has been the MAKNA philosophy since we started in 1994, and we will continue to hold firm to it in making sure that patients remain our top priority.